medical professionals experience organized chaos, and Keller medics rove Army versus Hawaii. This is the Regional Health Report. Welcome to the Regional Health Report for October. I'm Ann Krebs. Approximately 100 medical professionals from 15 installations across the United States deployed to Fort Hunter Liggett, California in support of a medical exercise testing their ability to operate a field hospital. Dan Ashley has the story.
I can't feel my leg.
I need a chest tube set up for the left chest. I got surgery. You guys want to come in and put a chest tube in?
The field hospital design is a new concept for the Army, and this is the first time that the Army has deployed a field hospital in this entirety, 148 bed capability in over 30 years.
What they've done out here is helping the Army write the doctrine of how a field hospital and hospital center are employed in the future and any future conflict we may be involved in.
I'd stack us up to any civilian hospital in our nation. But we also have to be expeditionary, ready to go whenever. And so this really exercises that expeditionary part of it. Our soldiers, sailors, airmen, Marines need to know that if they get injured doing what their nation asks them to do, or ill, that they have the absolute best medical care available.
When you say that readiness is number one, our contribution to that is our PROFIS. Without having the expertise, the clinical expertise in each of our formations, we can't operate our systems without them.
The value added by having PROFIS professionals like myself, other providers and nurses here, is that we're able to provide training for the medics, the technicians, and so forth that we work with.
They were just absolutely great. They gave us lots of guidance. They really took us under their wing. They showed us so many things I couldn't even fathom to learn before this exercise started.
You're up on a pressure bed. I have your blood. We have an 18 gauge on the right AC. We're going to start another liter of LR.
Live role players are, they can manifest their symptoms, they can behave a certain way, and it adds a little bit of interaction with the providers.
The thing that makes this special is the intensive care units. The ability to hold complex patients in volume is the key to this game.
27, 28, 29, 30.
This exercise has really been a good way for us to see how would we succeed? Will we succeed? How do we need to go from point A to point B for 3 months, 6 months, a year, 10 years from now to be able to deploy and truly take care of patients?
During football games at West Point, there are trainers and doctors ready to assist injured players. But what about those attending the game? This next story is about roving medics in the stands tending to needs of fans.
At West Point home games, 30 to 40,000 people gather at Michie Stadium for football and fun. But so many people, from kids to retired alumni, means the possibility of sudden illness or injury. Meeting the needs of spectators is the medical aid station team.
So we have our medical personnel showing up early in the morning, as early as 7:30, get ready, get our pre-combat checks, checking our equipment, get them over here to the stadium, get them the lay of the land, because we do have some new people every game who come in and help us out for the different events. And then we get them in, get them a little bit of break right before 10 o'clock, get some food, and then it's ready on. And our personnel will be walking around the stadium and here as needed for any injuries or illnesses that anybody in the stands or watching the game have during the event.
Just how busy is the aid station? That can depend on the weather or the size of the crowd. Sometimes it's just stubbed toes and ice packs, but real medical emergencies can happen. More serious injuries may require a trip to the aid station. If the trouble is beyond the treatment offered there, spectators may be transported to Keller or a local hospital.
Y'all need me? I got you. Got you, okay? Make sure you guys drink plenty of water. It's going to be hot. Oh, yeah.
Sergeant Angela West is a licensed practical nurse at Keller who's in her 3rd season as a medical aide. She's seen a lot of football, but she also keeps her eye on the crowd.
I walk up and down the stairs, all through my section, and I stay visible. And they make an announcement here at the beginning of the game and let them know that the medical support is right here in the blue vest. So I pay attention to those in the wheelchairs, my elderly, some people who are more disabled who may need a little more help. So these steps can get a little steep, So I watch for slip and falls, and I also watch for people who may seem like the weather may be affecting them.
During the previous home game, West helped an elderly woman who needed to be seen at the hospital for complications from an earlier fall. Having medical personnel on scene can make a real impact.
We're here to provide the support for everybody that's here, whether it happened prior to the game, during the game, and we stay for a short period after, so that their experience here at the stadium is a safe one for everybody concerned.
For the West Point aid station, the best outcome is few injuries and a West Point win. Reporting for the Regional Health Report, I'm Craig Coleman.
In other news around the region, Womack Army Medical Center requested assistance from Regional Health Command Atlantic in response to Hurricane Florence. Within 48 hours, nurses Major Becky Lux from Eisenhower Army Medical Center and Captain Henry Beeman from Kimbrough Ambulatory Care Center flew from Fort Belvoir to Joint Base Meyer-Henderson Hall. They picked up 3 medical techs, Sergeant James Dalton, Specialist Sophia Matozzi, and Specialist Adrienne Brown from McDonald Army Health Center. After a short flight, they are ready to provide flexibility to the Womack staff. That's the Regional Health Report. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, and iTunes. Thanks for joining us.